Hi, and welcome to today's video. In today's video, we're going to be discussing the 8 wastes of lean. Now, if you're unfamiliar with what lean is, there are a host of videos on this topic, but as a brief overview, lean is a philosophical model of continuous quality improvement that businesses or organizations can implement to help optimize their operations. And a big emphasis of lean is reducing waste within a business or organization's processes so that they can become more efficient and also improve quality for both customers and for the employees who work in the organization or the business. Now, it's important to note that even though this was kind of developed in a business context, specifically within Toyota, it can be applied across, broadly across organizations, including the healthcare sector. And that's kind of what we're going to focus on today is public health, the application of these principles in the context of public health. So before we get started, let's define waste. Simply stated, waste is any action or step that does not add value to the customer. So as we move through these forms of waste, some of them may seem a bit counterintuitive at first, but just ask yourself, is this thing or this process, does it contribute value to the customer or improve the customer or patient's experience in some way? So the first type of waste in the lean philosophy is transportation. And transportation can be wasteful if it's unnecessary. So for example, for people who are moving around a lot in a production setting or something of that nature, it adds to additional time spent on the job, unnecessary movement that can damage property or in some cases can actually hurt individuals if they're moving excessively. But in the context of public health, one example that seems timely is vaccination distribution. So for an example, if a shipment of vaccines has to go through 5 different carriers to end up at the distribution site, this could be an issue, one, because it does increase the probability that some of this product will be damaged, but it's also a lot of labor that's required from people. It's more time consuming and takes longer for this product to get to the people who are in need of it. So if you could eliminate some of that unnecessary transportation of resources, maybe by developing vaccines closer in proximity to the delivery site or increasing the number of production sites. These types of things might help eliminate some of this wasteful energy and money that's going into unnecessary transportation. The second type of waste noted in the lean process is inventory waste. Now, this is one of those types of waste that seems a little bit counterintuitive. You would think if you have a lot of material, how is that wasteful? But it can be wasteful because if you over-order product that maybe there's not necessarily a demand for, then you've wasted your capital. Also, by having inventory on your shelves, you're tying up your capital in things that are not currently giving you any type of financial reward, when you could be using that capital in alternative ways that might be more immediately lucrative. Now, in the context of public health, and specifically again with the vaccine example, if producers are ordering an excessive amount of vaccine in relation to what is actually there in terms of demand, then you're going to have some issues because you're probably at the end of the day going to end up throwing away some of these really expensive and important vaccines. So if you're in a community that is hesitant towards the vaccine, they're not quite ready to take that vaccine, at least not in large numbers, and your health department orders a very large amount of vaccines, and then you realize at the end of your vaccine clinic you have lots of leftover. Well, that's a problem because that was unnecessary money spent and unnecessary resources that are now going to go to waste. In addition, when you have these extra resources, you have to have somebody to manage your inventory, and that's another way that you can tie up resources in the form of people, but also in the form of money, because you have to pay someone who can keep track of all of these things. So this is just something to keep in the back of your mind when you're implementing the lean process, that you should really try to keep inventory that you know will be immediately able to go out to those who need it. The third type of waste in the lean model is motion. Motion refers to those unnecessary movements or processes that are not contributing any value to the customer or the patient. So, for example, if you're in a workplace and you have to continually walk down the hallway to get paperwork, or you have to repeatedly do something, search through your computer to find files, and it's really unnecessary, that's what we would consider unnecessary motion. So in the example of the vaccine clinic, if a nurse has to walk from her station to give a vaccine, and then she has to go back in and retrieve some type of paperwork, print things off for the patient, and then she has to come back and talk to the patient more. You see, there's just some unnecessary movement in this process that's really doling down the efficiency. Whereas if you could, make it to where this workstation is closer to the actual delivery location, then you're going to be eliminating some of that unnecessary time spent, and it can be straining depending on the situation for the person who has to go back and forth unnecessarily. So if you can make more strategic workplaces that are designed to eliminate unnecessary motion, that can be a good thing in terms of the time that you have available to do the tasks that are really those that are of value to the patient or the customer in the case of a business setting. So the next form of waste in the lean model is waiting. And waiting basically just means that. It means some person or some form of equipment is just waiting to be utilized. Perhaps they're waiting on equipment, or they're waiting on some type of resource that they need to do their job, or they're waiting on another person to finish whatever step is before them in the process of production. So for example here, if a nurse is waiting for a vaccine shipment to arrive, she can't really provide the vaccine to individuals who need it, who are also sitting waiting idly for their vaccine. So this is just an example of people's time that's not being used or respected, and if there are ways in the process that you can eliminate unnecessary downtime to become a more efficient process, that's also going to improve the quality, not only for the employee who has nothing to do, but also for the individuals who are waiting to receive a product, or in this case, a vaccine in the healthcare setting. The fifth form of waste in the lean model is overproduction. Again, this is one of those forms of waste that may not seem very intuitive at first, but when you think about it, it might become more clear. So if you're overproducing items, there's a chance that the supply may not end up matching the demand. In addition, when you have excessive items, again, you need people to manage your inventory, which costs money and takes time. You also increase the likelihood that there may be defects within these that people don't notice, because if you have too many products and items that you're storing, it's more likely that some of these defects are going to fall through the cracks and not be noticed by, the people who are distributing them, maybe until later when they're needed, And so at this point, you didn't fix something in the production process that could have been addressed earlier had you had less products that you were creating at that time. So again, it costs money to do this, and it can cost your company or your organization money. And again, in terms of a vaccine, if you're overproducing resources, such as the vaccine, again, somebody has to keep track of all of these, and you increase the likelihood that they may not all get used, and you might end up with waste again at the end of the day. So even though it seems like a good idea to create as much as you can and have it stored just in case, in the lean model, this really isn't the best approach. It's better to take an approach that creates the products when they are needed and in a timely fashion. So the sixth form of waste in the lean model is overprocessing. And overprocessing essentially means you're adding unnecessary steps or equipment or people to a process that really aren't necessary to lead to the end goal that either the customer or the patient expects. So for example, this could look like taking reports that are far too detailed, maybe using machinery that has way too many functions for what you're trying to accomplish, or even staff that are overqualified for the job that they're doing. So in the case of the vaccine clinic, this might look like a person coming in and they have to get their vaccine, but to get their vaccine, they have to go through a lot of loopholes, like maybe they have to get their oxygen taken, and then they have to fill out really detailed medical history that might not, be necessary for this vaccination. So, you're asking about their great-great-grandfather's history of cancer or something along those lines, asking, unnecessary questions that don't contribute to the final, really what's required in this process. So you're taking up too much time, you're using resources on things that could be allocated elsewhere, and might be even prohibiting some people from getting a vaccine in a timely manner because the process is too convoluted. So these are just some things to consider as well. The seventh type of waste in the lean model refers to defects. And defects just mean your product is not fit for use. So this could happen because in the production process, there are errors that need to be eliminated, or maybe in the delivery process, there is something taking place that's leading to a product, gaining defects. So in the case of a vaccine, if there are issues in, the packaging or something that is allowing them to crack or break so they can no longer be used, that's an issue that needs to be fixed. Defects are, again, a problem because you're putting money, time, and effort into creating something that is not going to be of value to the customer or the patient because they can't use it at the end of the day. So that brings us to the eighth and final form of waste in the lean model. Now, keep in mind the first 7 are the original 7 that were developed by Taiichi Ohno, who is the chief head engineer of Toyota. And this was developed for the Toyota production system early on. But later, when the Toyota production system moved to the Western world, we added an 8th form of waste, which is the waste of human potential. So if you're in a scenario where you have people with certain creative capacities, maybe they have the training to do something more than what they're doing, but they're not being utilized, or you're not creating a space in which they can use these resources, that's a waste of human potential, which is also going to be harmful to your organization and, prevent you from moving forward in the ways that you could. Now, in the context of COVID-19, where we are right now, an example of wasted human potential is, you know, when the pandemic became worse, a lot of elective surgeries were canceled because, you know, there was more focus on what was immediately necessary within the context of hospitals. And so a lot of surgeons who have these incredible capacities were just sitting at home and not being used. And that really hurt hospitals because, I mean, it hurt them financially because they weren't making money from these procedures that they typically make money from. And it also wasn't great for the patients because they couldn't receive surgeries that they were expecting and, you know, maybe needed even if it wasn't immediately urgent. And another example, back to the vaccine, is, you know, if you have people who have these creative capacities who may be able to develop great technologies for future vaccines that might be even more efficacious than the ones we currently have, but they're not being hired for whatever reason, or you know, people who are in a context are really honed in on one type of idea that they're excluding the ideas of somebody who doesn't really follow the main line, then you're not allowing human potential to flourish within this organization in such a way that it could, you know, benefit people down the line. So that can be a problem. So in conclusion, you can remember the 8 wastes of lean using a handy little acronym, Tim Woods. This includes transportation, inventory, motion, waiting, overprocessing, overproduction, defects, and skills or human potential. Thanks for watching.